cancer is just one of 4 types of cancer to be on the increase. Every year, almost 5,500 patients are being diagnosed in England. The reason is quite straightforward. People are not reporting their symptoms early enough. So what are the symptoms? There are 3 to look out for. A persistent mouth ulcer, one that you've had for more than 3 weeks. A white or red patch in your mouth, also for more than 3 weeks. And oral swelling, again for more than 3 weeks. Believe it or not, oral cancer is twice as common as cervical cancer, but few people have heard of it.
18 months ago, I found a rough patch of skin on the inside of my cheek. Didn't feel too right, so I went, after a couple of weeks, went to see my dentist to ask him about it. He wasn't sure at first whether there was anything wrong with it or whether it was just an infection, but we kept an eye on it, and then it ulcerated, so he referred me to the hospital for a checkup. They did a biopsy, turned out to be mouth cancer. When I had the diagnosis, it was probably the most terrifying moment of my life. But the unit at Chester referred me to the specialist unit at Liverpool, and they told me it was probably the best unit in the country, which was obviously very reassuring. And then once I got there, really good team, very supportive, and I was very pleased to hear that actually it was one of the most treatable forms of cancer and probably curable at the end of the day. So yes, I did feel like I was in the right place.
The main problem is that people are unaware of the symptoms of oral cancer, and therefore they don't report early enough with symptoms of the disease. The regional unit here at Aintree has cure rates equivalent to the best in the world, but we have to catch patients early. Early detection saves lives, that's the key.
On Merseyside, cases of oral cancer are rising every year. And it's not a specific age group, it's across the spectrum, from the young to the old who are being diagnosed. There are 2 simple ways to reduce the risk of oral cancer. Number 1 is to stop smoking. Smoking is a major contributor to oral cancer. If you do not smoke, then you significantly reduce your risk. Number 2 is to drink less alcohol. Consuming less alcohol reduces the likelihood of being affected by the illness.
I was getting ready for work one morning and I was brushing my teeth and I noticed I had a lump in my right cheek. I thought nothing of it and didn't do much about it for about a week or so, and then I went to talk to my wife and she said, well, I think you should go to the doctors with that. Anyway, that visit to the doctor resulted in a diagnosis of oral cancer at Aintree University Hospital. Successful surgery followed and a period of recuperation. But because I went to the doctors early, I'm now here to tell the tale.
For patients treated at University Hospital Aintree, many have unfortunately considered their initial symptoms to be trivial and simply not important.
If we can see people early enough, the cancer is caught at its initial stages. And then the team of specialists have a much greater chance of giving curative treatment. Rapid treatment saves lives.
There are 2 people in this world who saved my life. My wife, who made me go to the GP, and the surgeon at Aintree University Hospital who treated me. I now lead a full and active life. I'm here now because I went to the GP and got treated early.
I'm really pretty much back to full health now. I just feel I've been incredibly lucky in this whole process. My advice is for anybody showing any of the symptoms that have been described, go get it checked out straight away. It's treatable and it's curable if you catch it early enough. Get your dentist, get your doctor, get it checked out.
Please remember these important facts. If you have a persistent mouth ulcer for more than 3 weeks, if you have a white or red patch in your mouth, also for more than 3 weeks, and if you have any oral swelling for more than 3 weeks, get them checked out by your GP or dentist. It could save your life.